at the 45-minute mark now. We're going to go ahead and jump in. So good afternoon, everyone. Thanks so much for joining our session this afternoon. My name is Nicola Coakley, and I'm a research and policy manager in the managing director's office at the City of Philadelphia.
And hello, everyone. I'm Casey Henderson. I'm the Director of Research, Analytics, and Evaluation with the Office of Integrated Data for Evidence and Action. We call ourselves IDEA, and we also sit in the Managing Director's office in the City of Philadelphia.
Okay, so I know the brief today is forms, and while we both appreciate a well-designed government form, what we're going to be presenting on is a mechanism to avoid application forms altogether. We'll be walking through how administrative data can be used to automatically enroll residents in assistance programs that they qualify for. Specifically, we'll cover how and why the City of Philadelphia implemented automatic enrollment for Zero Fare, which is a public transit subsidy program. Just to give you a sense of what we're going to be walking through today, up front, we'll give some background on Philadelphia's context, the policy rationale for Zero Fare, and the program's design. Next, we'll talk through some of the practicalities of implementing automatic enrollment in the case of Zero Fare. Then we'll give some updates on how things are going a couple years into the program. Finally, we'll bring it all back to forms, and then we'll have some time for questions at the end. Okay, so to set the stage a little bit first, I'll give some background here on Philadelphia and the kind of origin story of Zero Fare. So this is really high level, but I just want to give some context for folks here on the kind of scale of the potential need for a program like Zero Fare in Philadelphia. Philly has a population of around 1.6 million people. And particularly compared to other major cities, we have a relatively high poverty rate. 1 in 5 residents lives in poverty, and 1 in 10 lives in deep poverty. And more than 40% of the city's residents are currently enrolled in Medicaid. Now, prior to the launch of Zero Fare, the city had been tracking on transportation as a barrier or cost burden for many residents. In the city's community needs assessments, which are fielded every couple years, Philadelphians living in poverty consistently raised that the cost of transportation presented a barrier for them to access employment, healthcare, and other essential services. For example, 38% of residents living in poverty listed transportation as the #1 barrier to their ability to get and keep a job. In a resident survey fielded before the launch of the program, close to 30% of low-income residents, those who would meet our eligibility criteria for Zero Fare, reported that they missed appointments, work, school, and personal activities due to the cost of transportation. So, in an effort to address this need, the city launched Zero Fare in 2023. The program aims to reduce the cost of transportation for households and improve mobility options for residents living near or below the poverty level. Zero Fare provides fully subsidized, unlimited transit passes to residents who qualify. These passes work across all modes on our transit system here in Philly. That includes our commuter rail and paratransit services. Okay, so when we were designing Zero Fare, there were some key considerations that kind of ultimately influenced our choice to lean heavily on automatic enrollment to deliver the benefit to residents. We had several implementation priorities, which are shown here in gold. We wanted to minimize barriers to accessing the benefit. We also hoped to achieve scale relatively quickly and to reach a representative group of eligible residents in doing so. And given that this was a new initiative with temporary funding, we wanted to make sure to build policy learning and evaluation into the program's design. There were also a few constraints, which are shown in pink here, that we wanted to be mindful of. First being that we had a very short runway between the program being announced and it officially rolling out. That was about a 6-month window of time. We also knew that the program's funding had a 2-year expiration date. It was initially structured as a 2-year pilot program. And lastly, given that this was a new, locally operated program, we knew that learning costs would be really high, meaning it would take extensive outreach and time to make people aware of the program and their potential eligibility if we were to try to use a traditional application-based or raise your hand model to deliver the benefit to folks. Lastly, there were some opportune conditions to innovate in this instance. These are shown here in purple. Because the program was structured as a pilot, we had a pretty compelling case to test and study a new approach to implementation. There was also existing infrastructure and momentum within city government to use administrative data to improve residents' access to programs and services. And lastly, Zero Fare uses a universal pass pricing model, which is a very wonky way of saying that the city pays for monthly usage or trips on all of the Zero Fare cards, rather than paying for the retail cost of a transit pass for every single participant. This structure means that every participant gets the same value of a pass in their hands, and some may use it a lot, and others may use it very little, and the city only pays according to total usage. This means that the benefit can be spread across lots of different types of users in a cost-efficient way, meaning there's no incentive from a resource standpoint to try to target the pass to those who might use it the most. So in response to that, big constellation of considerations from the previous slide and existing evidence on how best to overcome some of the barriers that are inherent in traditional application-based models to benefit delivery, we decided to implement automatic enrollment for the majority of program slots in Zero Fare. Under this approach, we use administrative data to identify eligible residents and sign them up for the program. Selected participants do not need to take any steps to find the program, understand if they might be eligible, apply, or opt in to participating. And recognizing that this approach may not be the best way to reach all types of eligible residents, 10% of our participants are enrolled through community-based partner organizations, an alternate pathway to enrollment. And those organizations serve individuals who would be unlikely to appear in our administrative data that's used for automatic enrollment. Okay, so now that we've covered a little bit of why automatic enrollment was chosen for Zero Fare, we'll talk about how we actually put it into practice. And this model was really only possible thanks to the work of Casey and her team who managed the city's cross-systems data hub. I'll hand it over to Casey to talk about the foundations in place that made this approach feasible for Zero Fare.
Great, thank you. So like Nicola said, now that we've talked about the why, let's get into the how a little bit. And before we really dive into the nitty gritty of the how, we just wanted to highlight sort of these 3 critical pieces that were really in place before this would have ever even have been, thought of as possible in the city, right? We really needed these 3 things to exist to make this what we're going to talk about subsequently feasible. So the first thing is an existing data infrastructure, right? Because no one is applying to the program directly, right? We are auto enrolling the vast majority of people. We need some sort of pool of high quality information to draw on to say, hey, we think these folks are eligible. And that data capacity, which I'll go into a little bit in the coming slides, has existed for almost 2 decades in the city of Philadelphia. So it's a robust infrastructure that we've had for quite some time. The second is really a process, right? It's great to have the data, but a process to actually like access and use that data for a specific project like a zero fare. And we at the City of Philadelphia also have that, right? We have a process that allows people to say, hey, I have this idea. I want to access data. How can I do it in ways that are compliant with local, state, and federal regulations around data privacy and security? How can I make sure I'm doing things that are legally and ethically permissible? And finally, and kind of most importantly, although sometimes I think it gets lost in the flash of data and technology, is cross-agency collaboration. Nicola and I both sit within the managing director's office, but it's a big office. We don't necessarily, work on the same sorts of things. So this sort of effort really requires a lot of dialogue and a lot of awareness of what capacities exist, what programs and departments are doing to promote that sort of collaboration that makes complicated projects like this possible at all. So those are really sort of the three building blocks that we needed to even contemplate doing this work. You can go to the next slide. So administrative data, right? What does that mean? We keep saying it. It's a big concept. It means a lot of different things to a lot of different people. So I'm going to give you what we mean in the context of my Office of Integrated Data for Evidence and Action, what we mean when we talk about integrated data, what we mean when we talk about administrative data. For us, right, that includes major systems in the city of Philadelphia that are collecting data about people. And it feeds that into one central repository where we integrate it. So again, we don't hold all data, right? Governments, everyone on this call knows, collect a ton of data. We don't hold all data for the city. We sort of hold key data elements from these different systems that you see here. And we pull them into one sort of environment that I'll talk a little bit more about. And again, the sort of key piece here is that how we're bringing these these disparate sources together is that we're doing it at the person level, right? Like government collects all kinds of data. It can be data, about the service we're providing. It can be geospatial data. The most important thing here is that our environment, our data warehouse has information about people, the residents that we're serving. And again, there's a lot of information coming from these systems, but we sort of like to think of it as the common attributes that you see sort of on the screen there, right? We have information about the people receiving a service or that the government is having a touch with. So we have a way of identifying the person. We have demographics about that person. We have information about the service or the touch that they received. We have start and end dates. If there was a provider attached to that service, we have that information. So while there's a vast sort of array of potential data that could be brought in, this is sort of like what we focus on so that it's somewhat normalized across these disparate systems. And again, just want to highlight that the importance of that last bullet point of collaboration. This system wouldn't exist without all of these different agencies and departments collaborating, right? This sort of central repository is not necessarily super common in governments, right? We all have our different silos where we collect data and information that's relevant to, the populations we serve and the programs we administer. So the real key takeaway around integrated data is that we're trying to break down those silos. We're trying to collaborate and bring data together in one common place so we can know more about people across these different domains, because people are complex and don't exist in the neat silos that we often have created in government to collect and store our data. We can go to the next slide. So I usually, when presenting about IDEA, don't go this into the weeds about sort of the technical process of how IDEA works, but for this crowd, I thought it might be useful to just get a very high level overview of what we're talking about here. So we have source data, and Nicola, I'm sorry, there are some animations to pop in. So we have source data that feed into our warehouse, right? So we start with those source systems on the left there. It's a little bit different than what a lot of people might think, which is that we have some sort of direct connection or API into these systems. We don't. We typically, while we can pull data from certain systems, data is typically pushed to us, and it's done so in sort of a standardized format that we call an interface file, so that the data is coming to us the same way every single time and is sort of very like standardized, so that as we're pulling in all these disparate sources of data, we're not constantly having to deal with source system changes that we can't control. So the source systems are feeding data to us. That is coming typically through a secure file transfer. We pick that data up. Most of these feeds that are coming into us are routine. Sometimes it's ad hoc, but typically routine, and it's quite frequent. Some are a daily feed, some are a weekly feed. Once we pick those files up, we obviously have procedures. We have homegrown ETL procedures that bring the data into our environment, transform it, and normalize it according to business rules that we've worked out with contributing agencies. And then finally, that data is brought together, right? We have information from public health, we have information from behavioral health. How do we know that that information is about the same person? We use deterministic and probabilistic matching, which is all very fancy to say. It's exact information, right? It's like exact matching on things. And it's also allowing for a little bit of what we call like dirtiness or fuzziness in administrative records. It's using both of those to match people across these systems, so that we can know that the Casey Henderson we see in the child welfare system is the same as the Casey Henderson we can see in the behavioral healthcare system. And all of that, again, is sort of homegrown, a homegrown algorithm. So after all of those processes occur, the data can be securely stored in the IDEA data warehouse. We are a warehouse model. And this data now, all it can do is sit there, right? It sits in a locked safe. And before we get to the next step, which is how do we get data products out of that safe, I want to talk through the process of how do we request and use data, which was the sort of the second bullet point that I mentioned, which is we need a robust infrastructure in place to allow us to use data for really important purposes like zero fare, but to do so in ways that are legal and ethical. So we can go to the next slide where I'll talk through what that process is. So now that the data is sitting securely in a warehouse, it can be accessed through the process that we've developed, this governance process. And it really begins with an agency or a group having an idea within city government and saying, hey, we're thinking of this. Can you work with us to try to define, what we want to do, how administrative data might support it, and whether we can do it. Once we sort of nail down that idea, we move to documentation. And I know we said no forms, but this is a place where forms are super important. Because documenting what we're doing with the data, what the scope of the project is, what data attributes are going to be pulled from the data warehouse, all of that is incredibly important to our process to make sure that, again, we're doing things in ways that are ethical and permissible legally. So once all of that is documented, things get routed for approval to our law department, and then to each data contributing agency. So if you want to make requests for your project that involve 5 agencies, all of those 5 agencies have to sign off on the use of that data. So all 5 agencies have to say, okay, we agree with this use of the data, with what data attributes will be shared, with who will have access to that data. We agree to it, we sign off on it. Only then can the safe, locked safe open. So after that, we work with the data requester to develop sort of a non-technical query spec that actually allows us to pull the data out of the environment and make sure that we have all the specifics of what we want that data to be very clearly laid out and documented. Then we can actually do the extraction. Then, for different projects that we have, the needs are different. So sometimes they require us to transform and analyze. Sometimes the product we're producing is just a data set. It's ready to use data set. Then finally, we securely transfer that, whatever that product is, to the end user. So that's sort of our build process with IDEA to be able to actually use this really great infrastructure that exists and to make sure we're doing it in ways that safeguard people's personal information. Go to the next slide. Okay, so a very long preamble about what IDEA is to get down to the nitty-gritty of how did we use this infrastructure and this process for this particular project. So there were 3 key eligibility criteria that we needed to satisfy, right? So the first was that the person lives at or near or below the poverty line. The second is that they're an adult between the ages of 18 and 64. Folks who are over the age of 64 already get free transit through SEPTA. And then finally, that they have a home address where we can actually mail the zero fare card, right? Because we need a way to give them the benefit. So those were the 3 sort of eligibility criteria. And then we had to go into the data warehouse to see what data do we have that can satisfy those eligibility criteria. And those were, for the first one, means tested program data where income verification is required. I'm sure as many folks know, there's lots of government programs at the local, state, federal level that involve income verification, and they're pretty robust in their auditing of that information. So for a lot of folks, we already know that they've shared their income information. It exists. And for a lot of these programs, it has to be re-verified on an annual and sometimes more frequent than that basis. So we sort of said, are you qualified for a means tested program, and were you qualified within the last 12 months? Next, for age, date of birth is one of the identifiers that is crucial for us to be able to match folks. And then finally, a residential address. Obviously, for many services and touches we have with folks in the city, we are getting address information, but sometimes we don't. So we needed records that had addresses attached to them so that we knew where to send the card. Go to the next slide. And then what was the upshot of all of that? When we looked in the environment, there were over 375,000 people in the warehouse that met those 3 conditions. So it was a ton of people. And then we created a ready-to-use data set. This was not a project where they needed any analytics or data visualizations. What they really needed was a list of all the people who met those conditions, who met the 3 conditions, and then contact information for those folks, right? And an address, and where we had it available, a phone number. And then we transferred that data to the Zero Fare team for the purposes of their lottery selection and to start outreach and to do all of the very difficult work of actually getting the card into people's hands. So that was a little of the how we made this possible. And I'll turn it back over to Nicola.
Okay, so I'll pick up pretty much exactly where Casey left off and give you kind of an overview here of what the enrollment process actually looks like after participants are randomly selected from the list of eligible residents that's provided by IDEA. And what kind of Casey alluded to, while enrollment is theoretically automatic in Zero Fare, we still need to reach people and get them information about the program, and importantly, the physical fare card. This was a unique obstacle for us with zero fare, as other kind of automatic enrollment practices that had been stood up at the city previously largely involved making administrative changes on the back end for people. For example, adjusting the amount of their tax or utility bill, using other administrative data to deem folks eligible for certain assistance programs. But in our case, outreach is a really critical part of the process. We need to find people to get them the benefit, but also to build trust that the program is real, particularly given the novelty of automatic enrollment as a practice and people's kind of comfortability with being signed up for a government program this way. Being kind of aware of this communication hurdle at the onset, we worked with community engagement specialists before the launch of the program to gather input and feedback from eligible residents about how best to communicate about the program and how folks had been selected. Those focus groups informed the design of the communication materials that we use to talk about the program and the outreach process, which is outlined here. So what's shown in purple here covers what the outreach flow kind of typically looks like for auto-enrolled participants. Selected residents receive an informational postcard about the program and phone and text outreach that gives them information about how the program works, lets them know that they've been selected and automatically enrolled, and that they should expect a fare card in the mail soon, and gives them a preview of what that envelope will look like when it comes in the mail. During this outreach, we also verify and update people's mailing information. We get that updated address information both from direct engagement with participants, as well as USPS mailing reports that we get from our mailing vendor who sends the postcards out, which kind of improves our ability to get like a really up-to-date address for folks who might have address forwarding set up at a new address. Then at the end of that outreach window, which usually lasts for several weeks, we mail the physical zero fare card to the kind of most recent, highest confidence address we have on file. It's kind of some combination of our information where we prioritize folks who've engaged with us directly over any other update, but we ensure to account for whatever after that is the most recent updated address we have for folks. Now, there's some people who, unfortunately, we are not able to successfully mail a card through this initial outreach process in the purple bar at the top. There are also others who we see in the data do not use the benefit after we've successfully mailed it to them. So for this group of people in those two situations, we take a few additional engagement steps, which are shown here in pink. We do additional kind of more targeted outreach to this cohort via postcard again, different postcard, and phone and text outreach again. And if we are still unable to reach folks in this group through those means, we ask Casey's team at IDEA to check against the integrated database to see if we've gathered more up-to-date contact information on these folks since the list was generated for us. If we have, we then restart the outreach process again to try and get those folks a card at the new information. Okay, so I've talked a little bit about why and a little bit about how. So now we just want to give some updates on, how it's been going. I'll say kind of upfront for this section that there's plenty more to come on this front. We're amid formal evaluation of the pilot program right now, but we'd still have to share some updates on how implementation has been going 2 years after the first cards went out. So in the 2-year pilot period, 37,500 residents have been invited to participate in zero fare. This number includes the 90% of participants who were auto-enrolled, as well as the 10% who were enrolled through community-based partner organizations. The program was ultimately able to successfully mail fare cards to 95% of those residents who were invited. This means that after the end of the outreach period, they had a valid Philadelphia address that we were able to mail to, and that mail did not bounce back to us at the end of the day. Of those who we successfully got a card to, 65% have used them to date. Now, rolling out a new program that largely relied on a brand new approach to distribution, we really didn't know what to expect in terms of uptake. Like, is this utilization rate of 65% on target? Should it be higher? Do we have an ability to make that number higher? And while we don't have a perfect benchmark to compare that uptake rate to, one stat that we've been working toward is from a resident survey that was fielded prior to the launch of the program. This is the same survey I referenced earlier in the presentation. It's part of regular representative resident polling that the city conducts on policy topics through an initiative called Philadelphia Voices. And in that survey, 71% of low-income respondents, those who would meet the zero fare income eligibility criteria, reported that a subsidized public transit card would have an impact on them. Now, typically, after each of the cohorts has gone through the additional targeted outreach process, which was shown in pink on one of the previous slides, our uptake rate usually goes up to around 68%. We have not gone through that full process for the last cohort that was added in May of this year. You can see the kind of big jump in the bars at the end of the graph here that I'll talk about in a minute. So at the end of the day, uptake of 68% gets us pretty close to that estimate of potential usership from the survey of around 71%. And that is kind of a target that we have in mind as we attempt to kind of improve our ability through this model to get a fare card to folks that they have the opportunity to utilize. Okay, so to talk about the graph here for a second, this gives a picture of what these two measures of enrollment and uptake have looked like over the course of the program. The cumulative total number of people who've been invited in the program over time is shown by the height of each bar in each month. And then among those folks, you can see the total who have used the benefit as of that date. That's shown in the darker pink portion of each bar. So one thing you can see here is that enrollment was phased in over time with early cohorts that were very small. You can see the first few months of us operating, you can barely see the bars on the graph relative to the later months. We made that choice on purpose to make sure that we had right size support infrastructure in place as the program scaled up over time. And then once that infrastructure was in place, the later cohorts, like the one added in May of this year, we were able to support much larger groups at one time. Another pattern you can see in the graph is how uptake, the darker pink portion of the bar, moves over time after folks are added to the program. It usually lags a little bit after folks get invited. So you can see these last few bars that are really high. This is the cohort that got added in May, a few bars ago. You can see that big jump in the number of total participants invited. And within that same month, a good chunk of uptake happens pretty quickly. We see like a big uptick in the darker pink part of the bar almost right away. But then over the months that follow, as we do additional outreach to folks, we see uptake continue to creep up in the months that follow as we kind of improve our ability to get folks a card at their most recent address. And then in terms of what that looks like from a kind of travel perspective, in 2 years since the first cards went out, zero fare participants have taken nearly 10 million free trips on public transit. The program was able to reach this scale, I would say, thanks both to the capacity of automatic enrollment to reach large cohorts of eligible residents quite quickly, and the program's pricing model, which means the benefit can be extended to lots of different types of users in a very cost-efficient way. At the individual level, that translates to a kind of active zero fare participant taking around 10 trips per week on public transit. Okay, as I noted before on the implementation consideration slide very early on, policy learning and evaluation were priorities at the onset of Zero Fair. We knew there were a few aspects of the program's design that presented pretty tremendous learning opportunity and the kind of chance for rigorous evaluation to be built in. First, we plan to use lottery selection to identify participants for automatic enrollment. That meant that some residents would effectively be randomized into a treatment condition of receiving a transit pass rather than self-selecting themselves into the program. Second, we knew automatic enrollment would be implemented at a very large scale, like in the tens of thousands of people, meaning there was a very large potential study group for a formal evaluation. And lastly, as Casey mentioned, we knew there were far more eligible residents. That number was over 300,000 residents who qualified than the program was going to be able to afford with its current funding level, meaning some residents would effectively be left in a control condition of not receiving a transit pass in any case. So to make sure evaluation was effectively incorporated into the program's rollout, we started working with our research partners who are at Georgetown University's Better Government Lab and the Urban Institute during the design phase of Zero Fair. And they provided really valuable guidance to us on how we could sync our kind of implementation activities with evaluation activities to make sure that we were setting the program up for success to be rigorously evaluated. And we have 2 external evaluations that are currently underway. The first is an implementation evaluation of Zero Fair's approach to enrollment. This will focus on people's experiences with automatic enrollment specifically from both a participant and practitioner standpoint. And the second is a randomized controlled trial evaluation of the program's effects on participant well-being. So we'll have much more to say about that when those evaluations are completed next year, but I'll just emphasize that it is certainly an added benefit of implementing automatic enrollment that it also positions programs, particularly new programs, well for really rigorous evaluation. Okay, and really quickly here, we're going to bring it all back to forms, which we know is the real brief of the day. So I'll say, from my vantage point, I think as people who are often in the position of being asked to design or redesign government forms and application processes, that it's from our experience, really worth pushing on the question of whether another application form is really needed in every case, or whether existing data can be used to streamline people's access to a program that we know they qualify for.
But a lot of that data, right, that we've relied on for auto enrollment comes from forms, right? That administrative data is just that our warehouse is probably most of it is coming from forms that were collected, in other departments. So while we want to avoid forms altogether, they're also crucial for creating that back-end infrastructure, and having really well-designed forms can help us have better, higher quality data, on the back end to actually be able to use. So well-designed forms are a crucial part of this, despite the title of our presentation.
All right, that brings us to the end here. We have some time for questions. We'll take a look if folks have put anything in the Q&A.
There are quite a lot of questions.
Okay, great. I've had my window small, so let me get that up.
So because I had a chance to look while Nicola was talking, so I can answer some of the answer one right off the bat that is more focused on the idea side. But there was a question, I think one of the first questions was about how do we ensure that data is used downstream in ways that are secure? So that upfront documentation I was talking about in our process makes sure that anytime people are receiving identified data, we know who will be using it. So name, title of the people that plan to access the data, we have a storage plan. Like, where does that data sit? How will people actually be accessing it? Sometimes, right, like we have to ensure that that storage plan meets certain legal requirements or regulations, depending on what the data source is. So all of that is documented on that form and needs to be signed off on by our law department and all of the data contributing departments. So that's how we sort of maintain control after we pass off the files.
Okay, thank you. I'll take one. Maybe we'll be going back and forth here. Pull out as many as we can in the time we have. Someone asked a question about offboarding folks who are no longer eligible. That is yet to be determined. We made the kind of policy choice to provide continuous income eligibility over the course of the program. As Casey alluded to, there are folks who age out of eligibility and into our senior fare program, which is a state-funded subsidized fare program. So those folks, we help transition to that program out of zero fare. But right now, folks have continuous income eligibility while we're operating in an extended pilot period. And then as we're kind of planning long-term policy structure of the program, we'll work with Casey's team to figure out what the process looks like for an eligibility window, and when that ends, kind of ultimately offboarding folks who are no longer eligible.
Okay, I will try to address a couple questions in one, because there were a few that sort of overlapped. But there were some questions about, like, how long was this, infrastructure in place? How long does it sort of take to get these approvals? And I know that tends to, people see that as a big barrier. So wanted to just give everyone a sense of IDEA's process. So again, IDEA has existed in its current form for almost 2 decades, so it's not a new capacity by any means. I don't want to make folks think like, yeah, we stood this up overnight. It's an existing capacity for sure. The actual project, right? When someone has an idea for a project and wants to be able to extract data for a particular use, that process of approvals is actually quite fast because it's internal, right? We're talking about data sharing internal to the city. So from folks filling out a project description, which is what we call that form I was talking about that governs the use, to actually getting legal approval and getting data contributing departments to sign off, it can be very quick. It can be 3 to 5 weeks at most. So it's quite consolidated, but again, it's because we've built a pretty robust practice over the years, and all of our sort of data contributing departments and our law department are very comfortable with that. Trust takes time to build. So again, I don't want to be sort of flip about like, oh yeah, it's super easy to create those capacities and we can get things signed off on so fast, and you could too. I think it's taken time to build sort of that practice and that trust with folks. But it is absolutely doable, and we do a lot of projects in pretty quick turnaround times.
I'll take one, which was about how we set benchmarks and targets for enrollment and usage. Like if we're looking at comparable cities and how we decide what success looks like. This is a really challenging one. We, like our partners at the Urban Institute, who are kind of leading this implementation evaluation, put out a blog post recently comparing, Zero Fare's uptake rate to other transit benefit programs that exist in other cities. But I think what makes a comparison here really challenging is because we're operating the program very differently, like how we define what uptake is for our program versus how a place that has a kind of raise your hand model defines what uptake means, I think is quite different. Like for us, it's among the pool of people that we've pulled off the list and are trying to get a card to, how many of them have used it. But like really the real policy uptake number is like how many eligible people have we been able to reach, which is maybe the kind of benchmark that other cities are up against. And so it's been really challenging. And obviously, cities have very different levels of transportation infrastructure. So the kind of use case for a public transit pass for people in different cities might be very different. But there is an interesting piece from Urban that we can like provide the link to if that's an option in the chat, so that you can see how our uptake rate compares to kind of other similar programs that are operating elsewhere. But it's a little bit of an incomplete comparison, I think, because of the way our program works like quite differently than how others do.
I'm happy to continue answering questions. I think we might technically be at time.
I think we are. Yes, it looks like we have an announcement up that breakouts are starting again at 2:30. We'll see if we can kind of hang on here, camera off, and if we're allowed to put anything in the chat to follow up with folks. And if not, we have kind of resources and materials that will be shared on the portal afterwards that will hopefully help address some additional questions here. Okay. Well, thanks so much all for joining. Really appreciate you taking the time to attend today. Sorry we weren't able to get to all of your questions, but really appreciate all the thoughtful questions in the chat here.
Thank you all. I mean, I'm happy to continue to answer questions if folks are still on. I know folks are running to different presentations, so but there were quite a lot of questions. So
yeah, and it looks like we don't have the option to do so within the Q&A, only verbally.
Yes, we can't like reply to the question.
Yeah.
Well, if anyone's still on, I can answer another question. I think there were a couple of questions about like how do we deal with data that come from disparate sources that might not match, right? So for example, this data source says Casey Henderson is, is female. This data source says Casey Henderson is male. This data source says Casey Henderson is female, right? Like, what do we do with that? And we use a process that we call best fit, which says that the frequency of the attribute, right? The frequency of whatever the categorization is what we prioritize. So if 10 if 10 records say that I'm female and 3 records say that I'm male, we're going to say that I'm female because that had a higher frequency. We have different rules for different attributes around best fit. And I will say, like on the, on sort of the front end, over the many years that this warehouse has been in practice, we've learned sort of what are the high quality data attributes and have taken, great pains to ensure that those are the ones that are feeding into the environment. So sort of anything that we're like dubious about or that doesn't meet our standards of data quality, or, we've had issues with during data, routine data reconciliation processes over the years, none of that is even coming into the environment. So the stuff we're bringing in really is what we consider sort of high quality information. But yes, we obviously get disparate sources not matching, and we have to figure out ways to reconcile that.